Thank you, Premier. So 11 new cases, a total increase of 10 with one reclassification. It is great to see that the total number of active cases now below 200 for the first time in a long, long time. Also only 17 patients in hospital, only one in intensive care and no one on a ventilator at the moment. So that's really a positive. Also to have healthcare worker current active cases below 20, so at 19 today, is terrific. And the active cases in aged care are still at 45, but it has come down significantly. It was over 100 1 or 2 weeks ago. So that's another positive. The numbers for today, again, 6 already linked to known outbreaks or existing known complex cases. Another 5 under investigation. Some of those, in fact, the majority, I'm sure, will be linked to known cases or outbreaks. The total numbers that we're seeing on a daily basis are primarily being driven by these outbreaks. They are complex outbreaks. They are challenging, but we are throwing absolutely everything at them. The Kilmore outbreak is a case in point, but there have been additional cases linked to aged care, Uniting Aged Well Preston, another case linked to the family outbreak in Frankston, the Kilmore case I've spoken of, an additional case linked to the Chadstone Shopping Centre outbreak, and another one linked to a complex case. We will get on top of these outbreaks. We always do. We're going to have fewer and fewer new outbreaks emerge, and so the underlying trend in the day-to-day numbers is being driven by those outbreaks. But the good news is that getting on top of those outbreaks means that the really hard to shift numbers are only at 2 or 3 per day. All the rest will be controlled when we control those outbreaks, and I think that's a real positive. But it is, of course, frustrating to see that slow, even if steady movement down over time. We've seen, a bit of a plateauing in recent days. That's very frustrating to see. I'm as frustrated as anyone. But the underlying trend, as I say, will get us there. Happy to take questions.
With that Kilmore mum, Brett, there's been she says there's been delays and conflicting advice up there. Does that worry you that we're still seeing problems there?
Look, I think we're moving to a point where the way that we manage small numbers and outbreaks is going to be even more comprehensive, even more precautionary than ever before. I think that applies especially to regional Victoria. I think that's an expectation of regional Victorians. They've done magnificently in stepping up for the testing, the more than 200 people who've been tested at the various testing sites and the over 200 individuals who are quarantining at home. We are going to a more precautionary approach with that next ring of isolation for contacts of contacts. There are some elements to work through between the advice that's been given centrally and regionally. We'll take those lessons, we'll hear that feedback, but we want to make it as tight as possible. And I can only thank the people of Kilmore for how they've responded. And if there's clarification around that messaging and to make sure that we're as clear as we can be about what amounts to complex responses. It's not easy to communicate some of those elements, and there will be changes over time because there'll be close contacts in that first ring who turn up positive, and that changes what happens to their household contacts and their close contacts. So there is some trickiness there, and I do apologise if there's been confusion, but we're committed to making it right, and we do want to take that additional precautionary approach now that numbers are so low, and now that we're out of stage 4. In stage 4 we were all effectively in a kind of quarantine situation. We were only leaving home for those 4 essential reasons. Now that there's greater movement in regional Victoria especially, we need to have that really strict advice for contacts and their contacts.
On some of those cases, Brett, in Kilmore, families were called up by the DHHS and told that their contacts of contacts had to isolate, but they say they weren't really given an explanation for it. They just said, it's an order that we've been given, we're passing it on. Is that acceptable, do you think? How important is it that when they get these calls, they need to be given the justification and explanation for why it's...
Yeah, I think it's important to be able to give that justification. If I can give it now, and look, we'll work through all of the messaging that has to be given across Victoria, and there are decentralised local public health units, regional public health units that need to get that message on board. It's a changing field, and we need to keep up with that changing advice. The justification is that close contacts have always been at risk from a case. They are potentially exposed people who may develop illness any time 14 days after that exposure. What we're doing with the contacts of contacts is recognising that when a close contact becomes positive or develops symptoms, they've actually been infectious for the 48 hours before they've developed symptoms, and maybe 3 or 4 days before they've got that positive test back. So we're trying to protect those other individuals in the household, the contacts of contacts, from going out and potentially exposing others, because they might have had transmission to them even before that close contact has developed symptoms or tested positive. And that's a precautionary approach that really puts another layer of protection around the community, because occasionally you can have a very short period of time as a close contact before you develop symptoms, and you've already infected your household members. Clearly you can't do that with 700 cases a day. Clearly you don't need to do that when we're asking everyone through stage 4 in Metro Melbourne to stay at home, other than for the 4 reasons. But it is an approach that we can and must take with these final numbers.
On that conflicting advice, people were told to isolate but then also go out and get tested, waiting in those big lines. Is there a need for drive-through testing or even the home testing in Kilmore, do you think?
I don't know what's been specifically arranged for Kilmore. I know that there were the 2 testing sites. They'll be ongoing. People can safely physically distance though in those queues, and there was oversight of that distancing. People of course need to wear masks, and we're talking about for the vast majority of people without symptoms. So the risk is really very low in an outdoor queue for testing, but you can't have drive-through for everyone, and it's not always practical when you're trying to get 200 people in a small town through in one day. They would be waiting for too long for some of those test results. So it's a practical compromise.
Where are we at with the Box Hill? Is it an outbreak officially?
Yeah, it's an outbreak in the sense that there are staff cases linked to Box Hill. The exact source isn't clear, but all of the staff are being tested across that entire health facility, and all of those who are close contacts are being asked to quarantine at home now. So again, we'll get on top of it, but it's a measure of the risk in any health setting, and we need to make sure that we've got that intensive testing process for staff, but also that we're supporting them to the fullest extent with PPE and with policy and procedures to protect them.
How many cases there now?
I believe there are 3.
And how many people are going to be tested there?
There are 4 active cases, so a total of 4. They're all active. They're all being tested across that facility.
With the Kilmore cases, the local health service has been getting involved, Goulburn Valley Health, and people there say they're getting 2 calls within 2 hours from different people that say they don't know, like it's repeating itself over and over again. How confident are you that those communication models are working properly and not overlapping? And is it a case of we're still trying to work out how that works, or do you think it should be at hitting its straps already?
Look, I think we'll always be open to whatever tweaks or tightening that needs to occur. I'm not aware of that specific issue being at play, but there is an absolute keenness to make sure that every single person on the list from the cafe who are identified as close or casual contacts are all being contacted. Again, apologies if people are getting inconvenient contacts. Personally, I would rather that inconvenience than missing out any single individual in Kilmore, and I think the people of Kilmore are also really keen that no one is missed out in terms of getting that reach out. But we will always take the messages back from those regional public health units about what's working and what's not working and tighten it.
And that one Kilmore case today, do we know who it is? Is it a worker from the place? Is it
we think it's a casual contact of the cafe, a direct casual contact of the cafe, so someone who went in for a short period of time.
So that would be the first one that's not a staff member or a direct contact with staff?
That's right.
Does that indicate we might have a bigger problem brewing, do you think?
No, I don't think necessarily. There are a lot of people who've been through the testing site. The vast majority of those results are through. They come through within 24 hours, as you know, and I think that's very reassuring. But this is why you do very broad testing. This is why you ask lots and lots of people to step up.
And in the town of Kilmore as well, some shops are, like the local vet, for example, is shut for 14 days. Some shops are shutting because they're wary. What's your advice to them? Should they be shutting out of precaution? What should they do?
Look, each to their own. I think, a business will determine what their level of risk tolerance is. I don't think the risk to those businesses is very substantial at all. But of course, they're weighing up what it means to be closed for a longer term if they have a staff case and then additional staff cases. And so I would leave them to make that call. I think the risk to them is very low. But it's for them to make that judgment.
To be fair, they'd probably be looking to you as our top health person to tell them what they should do.
So I would say the risk is very low, but it's for them to make a judgment about what the criticality of their workforce is and what it might mean for them to have a case.
How many people were tested in Kilmore yesterday, do you know? And how many cases are in that Frankston, Chadstone, Kilmore cluster now? Three clusters.
So the number in the Frankston family outbreak at the moment, there are 7 active cases and it's a total of 12 in total. The testing over 500. There are over 200 in quarantine, but hundreds tested. 679 people, in fact, have been tested over the last 3 days.
These outbreaks, Kilmore, Frankston, Box Hill Hospital, say you're thinking about releasing restrictions, are they all completely cast to the side when you think about it?
No, not completely cast to the side. Of course, whenever there's an active outbreak, there's the potential for other contacts to slip through, people who don't quarantine appropriately, people who don't get identified. So we always think about that downstream risk of further spread. But knowing where the additional cases have come from, having them linked to those existing known cases and known outbreaks is of course reassuring. It gives us a sense that there's a significant amount of control, but whenever there are active cases, whenever there are active outbreaks, there's that risk of further spread. So they're not cast aside entirely, but certainly they're more reassuring than a case that just pops up in the community where we've got no idea where it's come from.
As it sits today, how big is the contact tracing team?
I don't think it's changed. I think it's still over that 2,000 mark. Again, they've been repurposed in lots of ways. There's a much, much bigger focus with that workforce on community engagement and testing, and in the local incident management team set up and the outbreak management team set up. So they're much more focused on those active outbreaks and less on the routine, obviously, calls that come in for the close contacts.
Are you happy with that size? Is that about where you want to see it?
Look, it's not my judgment. I think it's more than enough for the work that we're doing, but it's absolutely clear that we need to pivot to a significant preventive approach, a significant engagement approach that really maximises all of those things that we need people to do each and every day. The primary one is isolation when you're symptomatic, getting tested and going home. You've got $450 if you have to wait for a test result. You've got $1,500 if you have to quarantine for 4 days, or if you're isolating as a case. I think they're really key messages that we need everyone to understand. The other bit is masks. I mean, I've seen so many people wearing masks. It's absolutely fantastic, but I do still see people, including in conversation, less than a metre and a half apart, both not wearing masks. A fitted mask has between 40 and 80%, if both people wear it, 40 and 80% reduction in transmission risk. Why would you not do that? I mean, I know the reason why people don't do it. They think, oh, this is my mate. I won't catch coronavirus from someone I'm familiar with, or I won't catch coronavirus from a family member. These are the people who are transmitting to others, the people we're familiar with and our family members. Obviously, our household members, we're not wearing a mask at home. But if you're meeting outdoors, and this is the advice and this is the public health direction, outdoors, another household, another family member, because you're meeting that 2 household and fewer than 5 people, 5 or fewer, you have to wear a mask. It reduces that risk by about half if both people wear it. It's really important.
With the Chadstone and the Kilmore outbreaks, it seems like our strategy for managing them has kind of changed halfway through. We changed to contacts of contacts halfway through the Kilmore cluster. Is part of the reason why we have such stringent targets to release restrictions that we're still ironing out our public health response, that you don't fully trust that we have got great systems in place?
No, there is never a time when we have not looked to refine our public health response, and that's not unique to Victoria. Every jurisdiction is doing that continuously. That's why I'm still having AHPPC conversations on coronavirus multiple times per week. We have to look at where we're at, what needs to be different, and as I say, through stage 4, when everyone was staying at home, that was a really substantial control measure. But we've got a different situation in regional Victoria where people are moving about, people have many more close contacts, and we need an additional precautionary approach to manage that risk because people are moving about. So the idea that we wouldn't continuously change our advice and continuously review our policy positions, especially in the end game. We're talking about the last days and weeks of coronavirus in Victoria, all things being well. So we have to make those changes, and of course they'll be in the middle of certain outbreaks. So we don't wait for something to be over if we think that we need to make a change to make a difference.
Do you fully trust the systems that we have in place?
Yes, I do. I mean, I accept that there will always be gaps and things that we need to tighten up, things that we need to review because there's feedback about what isn't working, and that'll be from our own staff, centrally, regionally, in our local units, but any community member who speaks of the difficulties or the mixed messages or the inconsistencies is a lesson for us, and we should take it as well.
Can I just ask as well, how you both talk about kind of being wary that there's more virus out there than we perhaps know about. Can you give us a sense of like how much that might be? How confident are you that you're picking up every case that's out there with testing?
It's hard to know how many cases are out there that you're not identifying, but we do know that when we've got an increased testing volume, so instead of 9,000 we've got 16 or 20,000, that more confirmed cases are identified. So that to me tells me that there's probably 30% or thereabouts that we're not finding on any one day, and it probably becomes a smaller number on a day when we've got great testing. It absolutely tells you that anyone who's symptomatic needs to come forward for testing, because that's what will get us to 0 cases, 0 community transmission. But I don't think it's a huge number. I think the fact that you find a case and you link it to other known outbreaks, even if that individual isn't aware of those existing outbreaks, tells you that people who are symptomatic come forward and we're making that link.
You spoke about the end game. This could be the last weeks of coronavirus in Victoria, but these outbreaks recently have, I think, made people fearful that it's not the end. Are you telling us that we still are at the end? Do you still believe that?
Yeah, I still believe it. We shouldn't be complacent. I'm telling everyone not to be complacent because this could fail. This could fail if people don't come forward for testing, if people don't follow the restrictions, and if people certainly don't isolate or quarantine when they absolutely have to. But those things being done well, we'll get there. There's no question we'll get there if people can come forward for testing, isolate and quarantine, wear masks, and do all of the things that we're asking of them. It's been a long haul. There's no question people are tired. There's no question it's been really the most challenging year in many, many people's lives, and that our reserves are low. But it's also amazing to see the resilience of people through this. And I think people have been resilient, seeing that slowly but surely we're getting to a point where we can have a much easier and less restricted summer going forward. I make references to Europe. Australia is not Europe. I'm not trying to say that we are, but they are going into a phase over winter where they've got months and months of mask wearing and staying at home and not being able to visit other households in the foreseeable future. It's going to be really tough for them. We are trying to be on a one-way track where every point where we go through another step is easier and less restrictive, and I think people have that in mind. I know it's tough, but I think the resilience that we've got will get us over that line.
So the Box Hill cluster, the extra new case, is that a patient or a staff member?
Staff member, as far as I know, yeah.
Does that worry you that staff members are picking them up? We've had all these interventions, supposed mask fitting and things like that. Does that worry you?
Oh, look, we don't want any new cases at all, but we do have to investigate with each and every case that arises what the root cause analysis tells us. But it's not clear in this case. But I don't want to see any more staff cases. We're down to 19 active cases in health staff of any kind, in aged care, in acute services. But I don't want to see another one.
On the 14-day average, it's been dropping fairly steadily for quite some time, but since Wednesday it's sort of plateaued about in the 9s. If it stays in the 9s for the next week or so, would you be more nervous about opening up come next Monday, or, when that announcement's...
Yeah, look, I think obviously we've got a target of 5 per day. As I've said, the reassuring thing is the outbreak contribution to that daily number. We could see that fall away pretty quickly as outbreaks come under control to that underlying number of 2 or 3. That would be much more reassuring. But it doesn't mean that there can't be a consideration on that day. But we just need to look at exactly what changes can be made with those numbers.
Obviously, we're at 11 as a rolling average when we ended our first stint of lockdown at the first wave. Things are definitely different, but why should we continue to put up with these restrictions if we ultimately weren't going to see a second wave if it weren't for hotel quarantines outbreaks?
Oh no, I think, hotel quarantine was the source of the second wave, but the contributions there were the number of mystery cases that were happening at that time and the rolling average. And so having that in mind and taking those lessons about exactly where you're at a point in time when you ease restrictions are really critical. And it's telling us that we can get to a point where a slow and steady approach with a very measured easing of restrictions means that we can have appropriate confidence that we sustain those low numbers or get to no community transmission for the long term. So it's not just a case of throwing our hands up and giving up. We just need to be happy that those numbers are guiding us as we take the next step.
Premier, can we ask you a question? Is your alleged subversion of the normal cabinet process?
The one additional case in Kilmore, Brett, was that person in isolation already? Had they been contacted?
I think so. I can clarify for you, but I believe so.
Do you know when they visited the cafe?
Not the date, not the exact date, but there were several days that we know of because of the staff members as well as the diner who were infectious at that time. But I can come back to you. I think we're done. Thank you.
Any other issues? Very good. See you tomorrow.